I'm Dr. Cristina Pozo-Kaderman. I've worked in the area of psychosocial oncology for about 27 years. I am presently at the University of Miami, and I oversee cancer support services, which encompasses all of the possible disciplines that you can think of. Maybe there's some we still haven't thought of, to help patients and families while they're going through their cancer experience. And that includes music therapy, art therapy, nutrition, exercise, acupuncture. So we provide all those services to patients. And then by training, I'm a clinical psychologist. I trained at Memorial Sloan Kettering, same place as Maria. And I think most of what I'm going to really talk about today, besides some of it obviously coming from writings and research, is really about the experience that I've learned from all these years of working with patients. But again, recognizing this is such a unique situation, this COVID situation is so unique that I really want to hear what others that are participating in this session would like to share, because I am by no means an expert, and I welcome others' feedback and input. And I'll let Maria go ahead and introduce herself. Oh, your mic isn't on.
Oh, thank you, Cristina. I'm Dr. Maria Rueda-Lara. I'm a psychiatrist by training. I am the medical director of psych-oncology at Sylvester Cancer Center, and psych-oncology falls under the umbrella of cancer support services. I've been working with cancer patients since my fellowship in 2006, and I'm really honored and happy to participate in this session about coping with grief.
So again, please feel free to add comments and chime in at any point during the presentation. So, you know, going to go through pretty much through the slides, and I'll add in some commentary. But the question is, what is grief? And I think we all know that grief is a very natural response to loss. It really refers to the emotional suffering that you feel when you lose someone or something that is very meaningful to you. It is experienced for most people as an emotional roller coaster. I think that people feel a sense of shock and anger and disbelief, profound sadness, but all these feelings sort of come and go, and they can all be experienced sometimes in the span of an hour or sometimes a day. It's very variable. So you can feel angry one moment, and later in 30 minutes later feel a sense of sadness and guilt and fear and anxiety about the person you lost and how can you go on with life. So I think that it's important to sort of recognize that all of these emotions are normal and typical and expected when you have a loss. In addition, you do have physical symptoms that are associated with a loss. And people don't often recognize that when you have this profound sadness and profound distress, it will come out in physical ways. And so it's not unusual for somebody to say they have difficulty sleeping or they have nightmares. I have a very young patient that I'm seeing. He's 36 and his wife died about a month ago now, and she was only 34. And so obviously he says to me, you know, that now he can't sleep, he has no appetite, he's been losing weight, he just has no desire to do things, very tired, and he's having a hard time understanding why this is all happening physically, because as he says to me, I've done a lot of anticipatory grieving, but again, nothing prepares you for the grief that you're going to feel and the pain that you're going to feel when something actually happens. And it's not unusual to, again, have some difficulty focusing and concentrating. Sometimes you can't think straight. And people do have aches and pains. You just really can feel physically not well. And as surprising as it is, it does come out in physical ways. Now, grief of a loved one is obviously one of the biggest challenges that any of us can experience in our life. But right now with COVID-19, we are coping with many other losses as well. And we are unprepared to deal with these losses and the challenges that we're facing. I think that if we thought back to December, none of us would have ever anticipated what we're going through. And so that fear and that grief of losing what we've so often taken for granted, be it our health, and we live now maybe with fear of catching something that has the potential to be life-threatening. And we look around, and while it may not be us, it's people we love that are close by that may be losing their jobs, or they're having to change jobs. And we look at the news and we hear loss after loss. Uber is now, cutting down on drivers. We see all of these restaurants in our community that may not be able to continue having business. We look at movie theaters and possibly not being able to have as many. So it's, again, watching all of this. So it's clear to understand for most of us, yes, the loss of in terms of a divorce or a loved pet. But right now, it's oftentimes, in addition to those major life stressors and challenges, it's the everyday things that we so often take for granted. And whether it's that loss of the feeling of safety, the loss of our daily routine, which we took for granted. We wake up, we get showered, we get dressed, we go to work. Well, now all of a sudden, that isn't there. So much of our life is not only the present, but we think about the future. We have dreams, we have plans, and now it's very uncertain. We've taken for granted that we can reach others and just kiss them and hug them and be close to them. And right now, that is often not possible. It's especially difficult for those of us that are working in a healthcare environment, and we're seeing all these people that are very ill and they can't have somebody that they love close to them. And then they depend more on the healthcare professionals to be able to provide that support. I was talking with one of my patients just yesterday who was saying to me that he's very concerned that he has to go in for a major procedure, a bone marrow transplant, and not having his loved one there. And what if things go wrong and something happens? But in addition to that, patients that are going in for COVID and they can't have anybody there. And it's really the healthcare professionals, the residents, the nurses that are becoming their family in a sense. So it's not only doing what you need to do medically, but it's now having to do so much more and sort of being a family member in a sense for these people that are sick and ill. And of course, the loss of financial stability and watching it happen not only to ourselves, but others and really the entire world. What we're going through is sort of unprecedented. My daughter, who's 17, will ask me, how did you cope with this in the past? And there is no past. We haven't coped with something like this before. And I do think this is something that will be talked about in generations to come. Now, when you're a healthcare provider, you have that additional stressor of being there to watch the trauma of those people who are sick and ill and fighting for their lives. So it's not only what we're dealing with, but it's then watching what somebody is going through and taking that in and watching it repeatedly over and over again. So it's that vicarious traumatization. It's a process. It's not an event that healthcare professionals go through with repeatedly hearing and seeing other people's pain and loss. And as a professional, there is this sense of anxiety. And I talked to some of my friends that are in New York and are we're dealing with it here in Miami, and they're dealing with it in huge numbers. And it's that anxiety and fear of what is going to come next. It's the anticipatory grief. How many more people are going to die. There's this agitation and distress among staff because, again, not only are you coping with your regular job, but now you're having to be more to these people. And it's not just one or two, but it's happening at an increased rate in a very uncertain situation where, again, there's a lot of limits in terms of any treatment and whether it can make a difference, and uncertainty in terms of the actual virus, which there seems to be differences that are brought up and sort of discovered, seems sometimes like daily, especially now when we're hearing about over 100 kids in New York that are being diagnosed with this very new sort of syndrome that's associated with COVID-19. So in terms of when we think of grief and loss, I think the most common person that we know of is a psychiatrist, Dr. Elizabeth Kubler-Ross. And she discussed the stages of grief. And what she discussed were really what were based on her observations of working with patients who were sick and approaching death and then dying, and then working with those families. And I think denial is so common. It's that lack of belief that this is actually happening. And I think we've seen that at some points in time when we see what's happening right now with the world, and we sit and we think, and as I said earlier, we go back to December, like, how can this really be happening? How can we be in this situation with this worldwide pandemic? And anger at times, how can it be happening? How could we not have predicted this, better planned for it? How can we not have something in place to better deal with this situation? The bargaining that we go through, what if we do all these things? Maybe it'll get better. That depression that you may find yourself in, it's not getting better, and the profound sadness. And then sometimes for people getting to that point of acceptance. And I think one of the things that Elizabeth Kubler-Ross really discussed is that these are all very natural feelings, but not everyone experiences all of these feelings when they go through a loss. They don't. Some people may feel disbelief and anger, but they may not feel sadness. Some people may never get to acceptance. So there is no normal way to grieve when you're going through a loss. And I think we're all now going through multiple losses. And there is no stage or discrete sequence. So you can feel anger and then later on feel disbelief, and then later feel depression, and then maybe feel somewhat of an acceptance of what's happening. But again, there is no direct sequence that people go through, and it's not discrete. You can have all the feelings at the same time within the span of an hour or a day, as I said before. And I think people often worry a lot about, should I be feeling this way? Are these feelings normal? And again, I go back, and I've heard this so many times when I've dealt with family members who've lost a patient to cancer, or even patients when they're dealing with the losses that the cancer has brought upon them, whether it's the loss of their hair, the loss of mobility, the loss of being able to have regular digestion and be able to enjoy their food if they've had esophageal cancer. Is this normal? Is it okay to feel this way? All of these feelings are normal, because there is no normal way to grieve. And the quote from Elizabeth Kubler-Ross, grieving is as individual as our lives. And I think that's important for people to keep in mind and not try to force themselves to try to feel something if they're not. And it's just important to accept what you're feeling. And that's sort of the first thing to talk about, is when you're dealing with grief, or many times if you're in a healthcare setting, also anticipatory grief and loss, is to allow yourself to acknowledge the loss, the pain, and also acknowledge that it's much more difficult now during COVID-19, because so many of the normal ways that we cope and we deal with loss and pain are not available for us. So if you feel the pain and the loss, this idea of trying to push it away and ignore it or say, I shouldn't feel this way, that is not helpful, because it is what you're feeling, and acknowledging it is sort of the most important thing you can do in order to be able to deal with it. One of the things that I've noticed a lot in social media often is this idea of being positive all the time. Think people will say positive vibes only. And you know what? It's not possible to always be positive. And it is natural for people to have moments of anxiety, to feel sad, to feel scared. Those are normal human emotions. And in oncology and psycho-oncology, we have a term for it. It's called the tyranny of positive thinking. This idea that you have to be positive all the time. And I think that can cause people as much pain and distress as trying to just, the situation itself, because it dismisses what somebody is feeling and it tells them it's not okay to feel it. So if you feel sad, if you feel a sense of loss, allow yourself. Dr. Rueda will talk later about, when those feelings may become too overwhelming and ways that you may need to reach out for help. But feeling all of this is normal in a sense. And I think that a lot of times we compare losses, and that's not helpful, and we shame ourselves. So I have somebody who told me the other day when I was talking to them, one of the patients, I shouldn't complain, I shouldn't feel upset because I have a home and I have food. And so there's so many people right now that don't have some of the basics. So who am I to complain? And I feel bad that I'm even taking up your time to talk about some of my stress. And that's not helpful, because if you feel it, it is yours. Your distress, your feelings are yours. And there's no need to shame yourself and say, this is not okay to feel. Even the loss of not being able to go to the gym. For many people, that is where they relieve their stress. And now they can't go. They get, yes, you can do it at home and you'll work around it, but you do get a sense of support by being there with other people. You get out of the house. So your losses are yours, and acknowledge them and try not to beat yourself up about it and shame yourself. If you've had losses in the past, at this point, they may be coming up more, because old losses, when you're feeling new losses, may trigger some of those old emotions. And again, allow you to process things in your own way. And sometimes what happens when you're going through a loss is you sort of pull away and you don't reach out to people. You don't want to sometimes hear things that people may say. Often you may get platitudes such as, oh, it'll be better later, or don't worry about it, it's gonna be better, or things happen for the best. And these platitudes may not be helpful, so you start to isolate and avoid, or again, that tyranny of positive thinking. So what you may need to do is really set up phone conferences or Zoom sessions with people that will be there for you, that will be able to provide the support. But we're humans, and we need social contact. So I think it is important to maybe just set up phone calls and do that. One of the things that has been discussed is that beyond the 5 stages that were originally delineated, there is a 6th stage that is called finding meaning in the loss. And not everybody gets to that. And I don't think that for most of us right now in this COVID-19 situation, we're anywhere close. We're sort of in the middle of it right now. And it's hard when you're in the middle of something to be able to look and take perspective and find meaning. But it'll be interesting to see as time goes on how we're able to really look at this situation and get some grasp and understanding of it. And then, take care of yourself physically. and take care of yourself emotionally. And I'm going to focus a little bit now on very specific ways. One of these things that can happen during this time is that we start really thinking about the worst possible scenario. We sort of do things to make it even harder on ourselves. Like I said, sometimes doing this comparative, comparing losses and shaming ourselves. Sometimes we start thinking the worst possible thing, or we start with the what if, and those are always situations that can lead to increased anxiety and fear. And there's so much that we can't control, and there is so much that we don't know. And so when we're dealing with uncertainty, some of it may really mean that we need to look at what we can manage and what we can control, and not focus so much on that long term. And so I was saying to one of my patients today that she loves to plan vacations, and they take 6 to 8 vacations a year. And she said, you know, I don't know what to do. So much of my life is planning ahead. So one of the things that I discussed is sort of finding short-term planning. So maybe set little goals for yourself that may be daily or weekly, and you can sort of cross them off. I think that the media makes a living, in a sense, by grabbing your attention. And there's so much news now that there's this part where they need to sort of outdo themselves, and it becomes more and more sensational and oftentimes focused on the negative and things that we can't do anything about. And so I do think that it's important for all of us to limit the time that we spend listening to the news and watching, and whether that means limiting to 30 minutes a day or 30 minutes twice a day, and making sure we listen to sources that are reliable and valid, and not things that are going to cause fear and anxiety. As I said before, I think that setting short-term goals can be very helpful, and things that you can control and manage. I think that if you're working, whether it's at home or going into work, scheduling regular breaks. The Zoom can be all-consuming, and I think that it becomes very hard to set limits on our days, and we find that we're on Zoom or on our email all day long, and it can become totally exhausting. And so scheduling regular breaks and reaching out to others and connecting and maybe drinking some tea, but that has to be done. I think that there will be something called in the future Zoom fatigue, and we do need to create an end of the day ritual, whatever that is, so that we set boundaries between our work and our home life, and we spend time doing things other than work. I think when you're dealing with a loss, and that may mean whether it's a loved one or a pet, or anything that you're coping with a loss, you do need to allow yourself, as I said before, to feel that. And so if you've lost recently somebody and you need to spend time looking at pictures or thinking about that loss, but then also make sure you find activities that we call more restorative. That means focusing on other things that can sort of be more uplifting, and alternate between those so that you don't get to that point where it's all the sadness all the time. I think this time right now gives us a chance to create either family tradition or friend traditions, that we may set up more regular Zoom happy hours, that we set up game nights, we do things that we create new traditions. I think setting up a regular sleep schedule is very important, and I go back to Zoom and being on the screen all the time, which can just not always be so easy. And I think this is a good time to be kind to yourself. And you know what? Explore new ways that you can cope with this new and uncertain time. And that means exploring new things for yourself. And so I'm going to show some pictures, and many of these things I've tried and some I've learned through the years. You know what? Maybe having a book club or just reading by yourself, but setting up a virtual book club. Cooking by yourself, cooking with others, learning new recipes. And I go back, we're social, humans are social. So finding ways to connect with others and share with others, so important during this time. Art. I think that not all of us cope in the same way, and I've learned this with patients, and I've learned this with family. And obviously, given what I do, talking is what I've been in therapy for many years. And so, but some people really find that a way to process emotion, to deal with their feelings, is through artwork. And whether that is drawing or painting or arts and crafts, and maybe just finding new ways to use your art. I actually find that doing virtual tours of museums for me has been very fun during this time. So how can art be more part of your life? Music, we all know music. We know we listen to a happy song and we feel happy. We listen to an energetic song and we're more willing to do more exercise. We know that music can be so powerful and healing. And so whether it's maybe picking up a new instrument, if you have the time, one of my patients is learning the ukulele now, and she's forming a Zoom group to do this with our music therapist, or whether it's listening to music. And we do have, there's so many programs right now online where you can listen to New World Symphony or really musicians all over the world. This is my favorite slide, I'll be honest. I think pets are so supportive, provide unconditional love, and if you don't have a pet, then sometimes just even watching dogs, online. And we do have Zoom sessions where we do interviews with pet owners and they talk about dogs. I was happy to see the Miami-Dade Animal Services a few weeks ago was empty because so many people had been adopting pets. But we also know that just touching a dog or a cat can be so soothing. And does release some of those happy hormones. Writing, again, this time, sometimes people will be able to just sit and write their feelings, and getting them out has been shown both research and clinically to be very therapeutic and helpful. It gives you perspective. I might be interesting years from now for other generations to go back and read what we're writing during this time. Laughter, of course. Finding some humor during this time, whether it's watching happy movies, finding ways to just enjoy each other. I've made a point to try to watch something silly and funny on TV every night because I really feel I need that with all the news. And again, going back to hobbies, picking up knitting, my daughter has started embroidering, sewing, jewelry making, whatever it is that might be helpful for you. Spirituality, I think that people are tuning in virtually to religious services, but for other people, it may be just praying, but other people, it may be meditating, it may be nature that's spiritual for them, it may be doing yoga, whatever is spiritual to you, I think can be so, again, soothing and helpful. Exercise over and over again. We know that exercise is helpful for everything, whether it's your health or your emotional well-being, your balance. So there's so many exercises now that are online and people can tune into that. Our own wellness center here at the University of Miami is offering Zoom classes, so easy to tune into that. And game night and learning new games. and having fun with that, whether it's virtual or actually playing cards. We've started doing that. I used to love Monopoly as a kid, which tells you how old I am. And my daughter was just oblivious to that at 17. So we started playing Monopoly once a week at night. So again, it's exploring and finding new ways to cope. That's really the key here. It's giving yourself that opportunity to see what works for you. I do say that meditation for many people can be extremely helpful, and I list that here. You can, there's so many free apps now available, Calm or Headspace. You can access the coronavirus anxiety workbook online, but it's really finding what is helpful for you. I've been trying to meditate, doesn't come easy to me, but again, I find other ways that are for me calming. But it's finding what works for you. The Wellness Center, yoga, they have yoga available, cancer support services we have online. You can go into the Sylvester website and we have many services available online. One of the things that I learned at a young age, my mom had cancer at the age of 27, was the daily practice of gratitude. And I still do that many years later, which really is about making a list and adding to it each day. And then when you wake up, reviewing that list. So, and making that list specific, not so general that it becomes meaningless. Like, I'm thankful to be alive. Yes. But I'm thankful to be alive because, and then you can list, because my dog is here with me this morning, because, very specific, because I was able to watch this Netflix series that really made me think about this, because I read this book. So not so general that it doesn't ground you. So adding to that list and reviewing it every day. And I've been doing that for many, many years. And periodically I let go of that practice. And I notice that when you do it, it sets your day up in a very different way than when I don't do it. And I think this quote sort of expresses some of that. Enjoy the little things. For one day, you may look back and realize they were the big things. And I think we realize that now so much because it's so many of the little things we're missing. But then do focus on those little things we still have. And I'll turn it over now to Dr. Rueda-Lara. Maria.
Okay, thank you, Cristina. So we've all felt blue, brokenhearted, and bummed out. But how can you tell the difference between natural sadness and depression? Everyone experiences bouts of sadness. In fact, sadness is a completely normal and healthy response to life's adversities. Depression, on the other hand, is a serious condition that often requires treatment. Feeling down and feeling depressed share similar symptoms. But clinical depression is the term that doctors use to describe a chemical imbalance that results from a combination of possible causes, including your genes, your brain chemicals, and your emotions. And though depression can be triggered by many of the same events that cause normal sadness, it is an illness that requires treatment, not just an emotional reaction. So when does normal sadness turn into depression? When feelings of normal sadness don't go away, in fact, get deeper and more intense, and there is a difficulty or major effort in carrying out daily activities, they can be signs of depression. Patients have persistent depressed mood with the inability to anticipate happiness or pleasure. The emotions in grief are likely to decrease in intensity over days and weeks. These waves tend to be associated with thoughts of reminders of the loss. In grief, self-esteem is generally preserved, whereas in depression, feelings of worthlessness and self-loathing are common. Symptoms of depression include persistent sad, anxious, or empty mood, feelings of hopelessness, and pessimism, guilt, loss of interest and pleasure, and pleasure in hobbies and activities that were once enjoyed, including sex. Decreased energy, difficulty with concentration, loss of appetite, restlessness, or irritability, and the most serious symptom, in my opinion, is thoughts of death or suicide attempt. Can you, the other side? Okay, so unfortunately we learned that an ER doctor in New York, the chief or emergency psychiatry at Columbia, committed suicide. After she treated patients, she got infected, she went home, and then she went back to work, and then died from suicide. So if depression is untreated, can lead to suicide. In 2006, suicide ranked as the 10th leading cause of death among Americans. It is the second leading cause of death for those under the age of 35. The annual suicide rate in the US is over 14 deaths per 100,000 population. Nearly 47,000 people died from suicide in 2017. And according to the CDC, one person dies from suicide every 11 minutes. So what to do? If someone you know is depressed, there are effective treatments available. Talking to your doctor is a good first step. Your primary care provider can offer support, treatment, and referrals to a mental health professional for other treatment options, which may include antidepressants and psychotherapy. And then many people believe that antidepressants are medications that cause addiction. They have to take it for the rest of their lives, but that's not the case. In many instances, I compare depression like treating like an infection that requires treatment. The majority of the time is limited. Time is limited. And also psychotherapy is extremely helpful. There are different modalities of psychotherapy. Supportive psychotherapy, cognitive behavioral psychotherapy, psychodynamic psychotherapy. So if you know of someone, recommend them to see a therapist and try it. If they don't like the therapist, they can move on and then try somebody who can help you or you feel comfortable with. So these are mental health resources that we can share them. Our email, we're part of the directory on the email. The Department of Psychiatry has worked with faculty affairs and created appointments for faculty members or staff. The CARS Behavioral Health 24/7, Find Mental Health Providers and Facilities, Aetna. The Students Counseling Center, mindfulness programs, and the University of Miami Osher Center for Integrative Medicine and mindfulness training.